Hi, also let us learn to plot the bilirubin value as per the NICE charts, which is the National Institute for Health and Clinical Excellence, which is followed in the NHS. So, according to these charts, you have the charts based on the gestation. It starts it contains baby's detail and it starts from 23rd week of gestation all the way up to 38 weeks plus. All right, and it we follow this till 14th day of life. So any baby who's a 40 weeker, after 14 days of life, you have to switch to the other charts. You will not continue to follow this one. Now, so this is the chart, and if I give you the scenario, there is a suppose a 30 weeker baby, and the baby is currently 25 hours old with the bilirubin value of about 250 micromole per liter. All right, so if you see the charts, so on we have the x-axis. X-axis contains the days from birth and the y-axis contains the value in micromole per liter. So on day 1 of life, that is 25 hours old baby, having a value of 250 micromole. So if we connect them, so it will come out to be above the exchange transfusion. So we have two lines. The blue is the phototherapy line and the red is the exchange line. So this value is quite high and we have to start with exchange transfusion for this baby. Now, when you have to tell to the consultant, so you will say that my baby whose value is 250 is way above the exchange line, whose exchange value was 150, and the baby, so if you see, the baby is 100 above the exchange value, and the baby's phototherapy range was in 80. So you will say it like that. Now, if you compare it with the other guideline, which is the American Academy of Pediatrics, which starts with 35 or more. So, in this, if you notice the difference being that the serum value is in milligram per deciliter. So, in India, we follow the AAP mostly, not the NICE guidelines. Some follows the NICE guidelines. So, in NICE guideline, the value was in micromole per liter, whereas in American Academy of Pediatrics follow milligram per deciliter. So the biggest question comes, how do you change the value from micromole per liter to milligram per deciliter? So there are two ways of doing it. So if you normally see NICE guidelines values is, since it's in micromole per liter and AAP guidelines is milligram per deciliter, NICE guideline will be around 250 micromole and the AAP values will be around 20 milligram per deciliter. So if you want to convert from micromole per liter to milligram per deciliter, there are two ways of doing it. Either you can multiply or you can divide. So if suppose, so you can multiply by 0.0585 or you can divide the value by 17. So the example for this one is that you have a baby with the bilirubin value of 450 micromole per liter. So if you multiply it by 0.058, so the value comes out 26.3, and if you divide by 17, so the value will come out to be 26.7. So there is not much difference between the two values. You can follow any of these. So if you like this video, please subscribe to my channel, and thank you for supporting me with the lovely comments. Thank you so much.